So, welcome, Dr. Allen. Thank you so much for joining me on the podcast. Um, I'm going to start with the first question. You have a very impressive background as a double board certified plastic surgeon. Can you tell us what initially drew you to this field and how does your journey in cosmetic surgery begins?
Okay. Well, thank you for having me. I'm really excited to be here. So, as a plastic surgeon, I have training in all manner of cosmetic surgery from the face, the body, and also hair transplantation. And, for the first 10 years of my practice in Chicago, I was doing the whole body. My specialty was breast implants, tummy tucks, and liposuction. So, a lot of mommy makeovers.
Yes.
But then I had my own hair transplant surgery. And when I saw that come in, and I was really happy about it because, as a high schooler, I was a hair kind of guy, right? I had a lot of hairstyles. And as I was losing my hair, it was really heartbreaking. So I had the procedure. And as it grew in, I thought, wow, this is incredible. And I decided after that to focus exclusively on hair transplantation. So now in my practice here in 2025, it's all just hair transplant. But because of that experience, I thought this is something that I have to bring to other people. The joy, the relief, and quite frankly, getting away from losing your hair and finding a way to help men and women overcome that was my new mission professionally.
I love it. Nothing like the confidence that hair brings. Actually, I have alopecia, and I haven't
Mm,
gotten a hair transplant, but because I guess I started like I realized earlier because I started to see like a little bit of a hole here, and I am
yeah.
actually like on treatment forever. So I use a specific shampoo. I used minoxidil for every night, and I also take some pills. And now I know at the beginning, like I wasn't sure if this was one treatment and that was it, but now I know that I have to keep going. And it's been amazing, like the difference. And
Good.
oh my God, because of course I suffered a little bit, like my hair is falling. That was like when I was 22, I think, so young. And I
Mhm.
was, and then after the treatment, it's amazing that we are at this point where we can do this. Because for example, my grandma also suffers from it, and she
Mhm.
didn't have when she started. It was she was young and she didn't have all these tools, and she doesn't have hair, like she wears a wig. So it's amazing that now you can do something about it.
Well, it looks like the treatments are working for you. You
Yes,
have gorgeous hair.
thank you so much. You too. You too. Okay, how would you describe your approach to patient care, specifically in treatments like this that can be subjective and so personal?
Yeah. Yeah. So the first thing I look at is to make sure they don't have a medical problem, right? There are inflammatory causes of hair loss that are treated medically and quite frankly wouldn't do well with hair transplantation. So I want to make sure that we're not doing surgery on people who don't need surgery but need something else.
Mhm.
Once we narrow it down to something that's treatable, and specifically androgenetic alopecia, hair loss related to your genetics, and commonly referred to as male pattern and female pattern hair loss, once we get it down to that, now it's really trying to figure out where they want the treatment and specifically where they want the grafts. Because the graft supply is precious and finite. And so you really want to put it in a place that's going to make a cosmetic difference. And for the overwhelming majority of people, male and female alike, it's towards the front. In the frontal hairline, sometimes in these what's called the corners, and then the frontal scalp. Some men need it here in their triangles. They're called the temporal points. And ladies too, when they're losing their edges towards the front. Now, there's a small number of people who want their crown treated here in the back. They want that treated first. And that really goes against convention. But if a person has enough supply, we can start there, but they need to know that later on they'll probably need something towards the front.
Okay, interesting. Who would have
Yeah.
known so
Yeah.
many different ways of doing it? That's why you definitely need an expert. Because I've heard that a lot of people are also traveling some other places, and it's not to say that there's not expert in some other places, but super important to do your research very well to make sure that you're doing, yes.
Absolutely. Absolutely. You're right. That, medical tourism is
Yeah.
very, very old. I mean, in fact, back in the 80s, my own grandmother had she had not a cosmetic procedure, but a medical treatment back home in the Philippines.
Ah, cool.
And people have been doing this for a long time, and you're absolutely right. There are fine, excellent doctors all over the planet. It's just hard for the person who lives in one country to go to another country and try to figure out what it is that they're getting into.
Exactly.
And your inability to do the research is what makes that tough.
Exactly. Exactly.
Hmm.
What do you think that sets your practice apart from others?
I've been with Advanced Hair now for just about 2 years.
Okay.
Before that, I was with another company, and what sets us apart is it really comes down to people and practice philosophy. And our practice philosophy is obviously do the best for the patient, do as much as you can so that they can be happy.
Mm-hmm.
And we try to avoid things that are gimmicky. We definitely avoid things that are, we like to be on the edge, but we're not going to experiment on patients, and we're not going to offer products that aren't FDA approved or otherwise proven,
Mm-hmm.
through big study. And with my team, we're able to do these procedures. And, in some patients, let's be honest, they need more than one surgery, right? And we let them know beforehand. But with the team that I have in place now, one surgery will get a lot done.
Okay.
And so that's how we try to handle the patients, just like their family members.
Exactly. And that's what you say is it touches on setting expectations from the beginning, and that's
Yeah,
the most important thing for for a patient to be happy.
right. Right. There's a lot of guys with a lot of hair loss, and
Mm-hmm.
the more extensive the hair loss, the higher the likelihood that you'll need more than one procedure. Maybe the first procedure will treat one part of the scalp, and then the second procedure will treat a different part of the scalp, or you'll treat the second procedure, use the second procedure to add density. And as long as they know that beforehand, most patients
Yes,
are easy to please.
understood. For patients that are considering hair restoration, is there any? Oh, what are the most common misconceptions that you see during your consultations?
The biggest one is what we touched upon earlier: one and done.
Okay.
I can have one surgery just like that guy did on Facebook, and I should look like this person.
Yeah.
That's a misconception. Another thing is that there's one technique that's better than another. So, in broad terms, there's the strip procedure, also known as FUT, and then there's the FUE technique, which is sort of called by some the punch out technique or the no scar technique. And it's really not a no scar technique, but instead of having the linear scar, the FUE allows you to get the grafts one by one and have a short haircut without anyone knowing that you've had a hair transplant
Mm.
procedure. And so those are the two main techniques. And one isn't necessarily better than the other, but it really depends on the patient, their age, and
Okay.
the kind of hairstyles they expect to wear in the future. So, as one example, I had the strip procedure myself. And for years and years and years, I had a strip scar in the back of my head, and I didn't even
Oh.
remember that I had one back there. And then I changed my hairstyle to the undercut, where, as you know, it shaves short, like a skin fade on the sides and the
Uh
back,
huh.
and then the top is at medium to long. And when I had the skin fade, you could really see that scar.
Okay.
And that made me realize that a lot of young people, even though they may have longer hair today, might want short hair in the
Mm-hmm.
future. And probably, in not all cases, but in many cases, the FUE technique makes the most sense, because should they decide to go for that shaved look or the skin fade, they're not going to have to deal with linear scar. There are creative ways to deal with that linear scar, and I had mine tattooed, but
Oh,
other
cool.
people won't have that luxury or won't want to go that route.
Got it right. Is it's one technique more cost effective than the other?
Uh, you know, some people charge less for this
Okay.
strip technique. So you might say that that's more cost effective if someone's on a budget, but I wouldn't choose my procedure based on the price. And I wouldn't choose
Okay.
it based on I'll pick the strip because it's less expensive than the FUE. I see the
Mm-hmm.
hairstyles that we're in the future, and then make choices based upon that. As far as the yield is concerned, some people think that they can get more with the strip, and I disagree. I believe that with the FUE technique, we can get the highest number of grafts. And in the future, maybe if they want to go for a strip, they can, but at least let's not start by putting that scar on the back of someone's head.
Perfect. Great, great info for people that are looking into getting a hair transplant because a lot of people, of course, they don't know they might go for the most cost effective, but definitely listen to
Yeah.
your doctor.
Yes. Yes. Yes.
Running a practice is as much as a business as it is about medicine. What were some
Hmm.
key lessons that you learned, like being surgeon and then practice owner?
Boy, managing overhead is one of the difficult things of any business, whether you run an athletic store or
Yep.
a hair transplant practice. And the marketing expense,
Hmm.
especially when I started my practice a long time ago, was outrageous. And you can spend a lot of money today. So, what people really need to know is that your overhead expense is the most important thing to keep control of.
Hmm.
Marketing is difficult and can be very costly, so you have to really be smart about that.
Hmm.
You might have to hire the right people
Yeah.
to help you take care of them, fitting people, especially if you don't have a background in business. It is probably to your best interest to hire and outsource the marketing if you can.
100%.
Staffing is your next most expensive line item when owning a practice, and hiring the right people and trying
Hmm.
to do that once. That's really what it comes down to. And I've surrounded myself with excellent people, and I have great people who not only on the team but manage the teams, which make this practice successful.
Yeah, there's nothing. Yeah, managing people is one of the hardest things that there is. It's amazing, but
Hmm.
it's lots of personalities, lots of priorities, lots of so it's not just you doing a surgery where you're an expert. It's now way more than that, and taking everybody
Yeah, yeah.
into account.
There, there are people's livelihoods at stake here.
Yeah,
So you want to
exactly,
hire right. We don't take this lightly.
exactly.
We respect people, we respect our staffers, and we know that they have lives outside of our practice. And we need to take care of them so that
Hmm.
they can take care of our
Yeah,
patients.
exactly. Because it's
Hmm.
not when a patient goes for a medicine procedure. Of course, they want a result, but the way they treat them, the way they make them feel, it's as important.
Yeah.
Yeah. How has your practice evolved on the last few years in terms of maybe your team or services or even technology?
It's interesting. I was when I was in my first 10 years here in Chicago with that other company. I thought I was doing great work, and I had many happy patients.
Uh-huh.
But since I've changed over to advanced here in Seattle, I've really seen a difference in technology. We're using a proprietary machine to help us harvest the grass, which allows us to do this
Wow.
in a no shave technique. We have instrumentation that's smaller than what I was using before. So now I'm able to get more grass per square centimeter, higher density. And all of that would not be possible if I didn't have the right people around me.
Hmm.
If we can't place these grafts, no matter how tight they are, then the patient's not going to get the result that they're expecting. And so between technology
Hmm.
and superior staffing, that's really what's changed in the last few years of my practice here, especially in Seattle, where I am. My company, we do have offices in not only Seattle, but Los Angeles, Dallas, Houston, now Chicago, and Atlanta. And
Mm.
we're taking great care to hire the right people with the proper experience so that we can provide patient care and results that we're expecting and what we demand of ourselves.
Exactly. Do you think this technology? It's how do you think it's going to advance? Because like from what you're saying, it's helping you guys with the process so much, and also with the time.
Yeah. You know, uh, One day in the future, you know, if we could clone hair, right? Wouldn't it be
Oh
wonderful if a
wow.
patient could come in one? We would take a small sample of their scalp, grow the grass in our lab, and then have them come back a couple of months later and then plant the grass,
Oh, even
and
better.
then grow some more, plant again. That would mean a nearly infinite supply of hair to
Mm-hmm.
move. And that would be something that we would love to do. We're working on it. People are working on it. It's been studied, not yet ready for prime time. And I know
Mm-hmm.
a lot of patients say to me, well, wait a minute, if we can clone a sheep or a cow, how come we can't do hair?
Right.
And the answer is, I don't have a good answer for that. I'm not a researcher, but it's not yet come to prime time where we could do that. But that would be one thing. The other thing that's coming, that's much more successful these days is the medical therapies for inflammatory causes of hair loss, right? The scarring alopecias that are
Mm-hmm.
more responsive to immune therapies are becoming more and more successful. And when you read about that, you just have to know that that might not apply to me because I've got male pattern hair loss,
Uh-huh.
but other people who have inflammatory medical hair loss, they can respond to those treatments without having surgery. That's very exciting. And then the last area is maintenance, right? Because, moving hair doesn't mean your hair loss stops. And I have to remind all my patients that, yes, I can move permanent hair to the top of your head, but you need to try and keep your native hairs around.
Mm-hmm.
And the therapies that are coming around in the next 5, maybe fewer, maybe more years from now will help men and women keep their hair so that when we move the finite number of grafts, they'll ultimately have a better result.
Amazing. Like, the industry is moving so fast, and it's so
It
exciting.
is.
Yeah. Are there any decisions that helped you scale your practice that you can think about?
Scaling is, I would say, most limited not by space, but by personnel. When you can
Mm.
find the right people to put around you, it's easier to scale the marketing, scale the space, scale the equipment. All that stuff is easily done. It's the people power that's the most difficult and the most rate limiting. But otherwise, yeah, building out offices is great, but marketing to the appropriate patients and staffing, that's where the challenges lie.
Exactly, because there's no scaling without delegating, and to delegate, you need somebody that really takes charge of things the right way.
Yes.
Any other maybe innovations? I know you touched on a little bit a little earlier, but trends that you've seen, not just in hair restoration, but aesthetic medicines that you're excited about?
Well, skincare has come a long way. They're doing a lot with estrogen deficient skin, which is an
Mm.
important segment of the population, right? There are new therapies out to help brighten and tighten skin for especially the females who are
Mm-hmm.
getting estrogen depleted as they get older. That's very exciting. There are new light therapies in the red light therapy realm, which are getting very exciting for helping with skin tone and texture.
Mm.
Um, there are other techniques using subdermal heating of the skin, if you will, to tighten skin. That's very exciting. There are new fillers, there are new neurotoxins. So, certainly as we get older, we're getting a lot more techniques and tools to treat getting help us age with grace.
Yeah, that's something that also excites me a lot too. A lot of more things coming without that are not so invasive, right? So it's something that you get done in a day, super quick, and
Yeah,
and it really works. So, and of
yeah.
course with that, the also the cost effectiveness is going to keep improving in the future probably.
I think we all have to remember while you're young and you have great skin, do everything you can to maintain that by drinking a lot of water, high SPF sunblock, avoiding sleeping with your makeup on,
Mm-hmm.
don't smoke,
Mm-hmm.
limit your sun exposure, things like that. If you can do that while you're young and not really so worried about aging, then as you get into your older years, it's easier to treat.
I agree, and go to the dermatologist. Know what lotions or your skin needs or your skin can benefit from, because you see yourself in the mirror and you think that's me forever, but take care of it from now, and then you'll be able to keep it longer, right?
It'll certainly pay off.
Yes. Where do you see the biggest opportunities for your practice in the next few years?
I think our biggest opportunity is an expansion, really, because
Uh-huh.
the market for hair transplant is just getting larger and larger. And as more people find this an acceptable procedure to do, the demand is just going up. We're getting older, we're living longer.
Uh-huh.
There are new stresses in a modern society that are contributing to hair loss, in addition to the endocrine situation and hormonal situation that we all struggle with. And so the opportunities are in being able to meet patients where they are and provide them what they need.
Yeah, I see. I really do see more and more people talking about it. Where before, not really. Nobody would ever like talk that much about hair loss, and I hear it all the time. And I also see it a lot in social media. So lots of
Absolutely.
doing. Yeah. Okay, now let's talk about uh, your practice and marketing for a little bit. What's been the most effective way that you know that has brought you quality patients, new patients that is not like word of mouth?
That's a great question, and it seems to be changing. But the short form reels and stories that are on
Ah,
social media seem to have the most bang for the buck.
interesting.
We do like still images, especially the before and afters,
Mm-hmm.
and it's been written up as not being as effective these days. It's still effective because people love to see transformations,
Yes.
but in video form, in short form, especially because it seems like attention spans are getting shorter and shorter,
Mm-hmm.
are getting to be more and more important. So the reels and the stories that are on social media these days,
Amazing. And for
I think
those
that's the
reels,
yeah.
it's mostly like it's organic content, or you add paid advertising to those reels.
It's a combination of
Okay.
both, and we try to maximize the organic, right, by
Mm-hmm. Mm-hmm.
providing information useful and helpful to the populace and showing what's possible. That
Yeah.
helps us on the organic side.
Okay. Got it. What's your biggest challenge to attract new high quality clients?
It really does come down to price for many patients because
Mm,
there's a lot of people out there who are struggling in this economy
yeah.
who
Yeah.
really can't afford high-end surgery,
Yeah.
and excuse me, and that's why they look to go overseas to have procedure done on the cheap. And for them to understand the cost of doing business in America, it's sometimes it's
Cool.
challenging, because people want things, they want deals. They see that other people are getting deals, they want deals, and so I would say that the economics, what we're all facing with, what's going on with the stock market, the economy, with tariffs and all that other stuff, and layoffs, importantly,
Yeah.
um, people stressed out financially.
Yeah. And maybe something that you guys could do is set some expectations with even with like the marketing, like no educate people that this is not a super cheap procedure, but that is very
Yeah,
important that they find the right doctor to do it, right? And it's
we'll
gonna
stand by their
pay off.
side.
Yeah.
Yeah, we're here for them. We'll stand by their side, whether there's
Mm-hmm.
complications, which are very, very rare and infrequent, um, or dissatisfaction. Again, rare and infrequent, but it does happen. So
Right.
we're here for you. We're going to make sure that you're happy, and so we're not a flight away. We are literally down the street from you.
Exactly, yes, because that's one of the things that people might not take into account. Like, this is one
Yeah,
time thing. I go, I come back. Okay, what if something happens? Then I don't
exactly.
know. Maybe you end up paying the same if you have to go back than what you would have paid in the U.S.
Better medicine for sure.
Yeah,
That because you don't want to think you're the person who has a complication,
right,
and then if
right.
it does happen, really tough, especially if your doctor is not within reach
Uh huh.
and able to help you.
Have you ever felt stuck or unsure about what marketing strategies to use?
You know, marketing is tough,
Yeah.
and it constantly feels like the rules are changing, the so-called algorithms are changing. So not knowing what to do is a constant question. Is this working? Is it not working?
Mm-hmm,
And
mm-hmm.
so it often feels like we're stuck, and we have to shift gears quite often.
Yeah. Okay. Interesting. Because
Yeah.
100%, we
Yeah.
because I am in the industry, and you see things change a lot. But the same platforms, sometimes things change to benefit more the platform than the users and the clients, and it
Mm-hmm.
sucks a little bit because it makes my job and whoever works in marketing harder, because then now you have to put in way more work, so the platform doesn't end up benefiting more than the client.
Yeah.
Um, if you could wave a magic wand and solve um, one thing in terms of growing your practice, what would that be?
The magic wand would be waved in the direction of staffing. We
Oh,
really need talented people around us, and hair transplant is not something that people learn in school, so it's kind of on the job training. The work is long and meticulous, but very
yeah,
rewarding. But you have to get people through that, and if we could wave the magic wand and patients could see the benefit of what they do, and how they would benefit for themselves personally and professionally, that's where I would wave my magic wand.
all right. right. Well, thank you so much, Dr. Allen. This was a very insightful conversation. I learned a lot. We touched not just about hair restoration, but other things in the medicine space, and also a little bit of marketing and running your business in the medicine space.
It was great talking to you, Maria. Thank you for having me.